Cancer Care Center here in Elizabethtown. Who's aware of that? Pretty awesome. We have the director from the Cancer Care Center, Dr. Adam Lai. He's a hematologist and oncologist from that cancer center. And he's going to come and speak to us for a few minutes, and just give him your undivided attention, because he's the one out there on the front lines trying to find cures and help people with this. And so let's give it up big time for Dr. Lai.
Well, good evening. Thanks for having me here. I'd like to kind of give you an overview of kind of where we've been, where we are, and where we're going. Also known as kind of bad news and better news. So I hope you guys like statistics. I do. So first, I'd like to say I'm honored to be here on behalf of the 22 plus employees that are new Cancer Care Center, as well as our 2 volunteers and other staff. I'm sure I'm leaving people out, but I'm here really representing them. So, where are we? So in 1980, if you were diagnosed with cancer, less than 50% of patients diagnosed with cancer in 1980 would live for 5 years. So fast forward to 2010, about almost 70% of patients diagnosed with cancer will live 5 years or more. I think that's pretty good. So, where were we? In 1991, Americans, or compared to 1991, Americans, all of us in this room, overall have a 20% lower risk of death when cancer rates were at their highest in 1991. So compared now, 2014, compared to 1991, 20% less risk of death from cancer. I think that's pretty good as well. So where are we now in the year 2014? So now when you look at the overall cause of death for most adults aged 40 to 80, it's not heart disease, it's cancer. So that's the #1 cause of death. Again, this is the bad news. I'm not trying to be a downer, I'm going to get to the good stuff. So in 2013, it was estimated there were roughly 1.7 million new cases of cancer in the U.S. In our state, we had about 25,000 new cancer diagnoses. And I will tell you, our state per capita is ranked #1 for cancer. We're the worst state in the country for overall cancer per capita. So, where are we now? Some cancers are thankfully decreasing. For males, prostate cancer is on the decline, lung cancer, colorectal cancer. For females, colorectal cancer is on the decline for them as well. But some cancers are increasing. So melanoma, thyroid cancer, liver cancer, all have a little bit of an increased prevalence these days. So where are we going? And this I think speaks to the important parts of events like this. So by 2030, the number of cancer cases will increase in the United States by 45%. And cancer will become the leading cause of death, overtaking cardiac disease for everyone, when you look at all ages and populations. The reason for this is because the population is aging. So as we get older, we're more at risk of being diagnosed with cancer. So what does that mean? That means that in in the year 2022, there'll be a 30% increase in cancer survivors. Well, those patients need support and they need long-term care. There'll be a projection of 18 million cancer survivors by the year 2022. That's a huge amount of people, but also a huge improvement. So why the improvement in this? Well, a big reason is because of events like this. So I did a little research on Relay for Life, the American Cancer Society, So this organization, 16% of the dollars go to cancer research, 31% go to patient support, 15% into prevention info and education, and 10% into detection and treatment. Well, what does that mean in dollars? This is pretty good. So 96% of this money, and I'm about ready to tell you, came from people just like you. So $160 million went to cancer research, $160 million. $304 million went to patient support, $153 million went to prevention, information, and education, and $97 million went to detection and treatment, all from people like you in this room. So, cancer care is getting better. People are living longer. We have a better understanding of cancer. So, again, I like statistics. I like proof. So here's your proof. In 2013, there were 17 new drugs approved by the FDA for treatment of cancer. There were drugs for thyroid cancer, metastatic lung cancer, mantle cell lymphoma, chronic lymphocytic leukemia, breast cancer, metastatic pancreatic cancer, bone cancer, multiple myeloma, melanoma, and prostate. Pretty good. More proof. In 2014, up to April, we've had 7 new drugs approved. Metastatic lung cancer, acute lymphoblastic leukemia, gastric cancer, chronic lymphocytic leukemia, melanoma, ovarian cancer, colon cancer, and there are a bunch more on the horizon, and I wait every week for these drugs. So, why am I here? So I'm a fellow Kentuckian. I trained at the University of Kentucky. Always wanted to take care of my fellow Kentuckians, and I'm here now in Hardin County. So, we have a new cancer care center. We have a 12,000 square foot facility. It was designed by former and current patients. So I invite you all to come out and you can check it out anytime. We offer a full array of services there. We have our clinic space, but we also have 24 treatment bays. So our cancer center is affiliated with the University of Kentucky Markey Cancer Center, which is the only National Cancer Institute designated center in our state. So what does that mean? That means even more opportunities for support, for research, and for treatment. So we're bringing this right here to our community. Our institution services 10 counties. That's 350,000 people. So we take care of an awful lot of fellow Kentuckians, and my goal is to have a center that we're all proud of, where you all can get all the care you need for your family right here. So, I'm happy to be here. I'm very excited about where we've been, both historically and where we're going. I'm really excited and proud about what we're doing here in Hardin County. And I think this is a fantastic event, and congratulations to not only all the survivors, but all the people that have supported you throughout your fight. Thank you.